This is a short film to share the story of the Children and Young People's Provider Collaborative in Surrey. A provider collaborative is a partnership arrangement involving two organisations with a shared purpose. Surrey Heartlands and Surrey and Borders Partnership NHS Trust are working together to deliver the Children and Young People's Provider Collaborative. The partnership allows us to plan and develop specialist services to meet the needs of children and young people with complex mental health difficulties at a local level.
A provider collaborative is a partnership between different organisations in the same geographical area that come together to commission or purchase high quality inpatient specialist mental health care.
It's no surprise the pandemic has had a significant impact on the emotional health and well-being of children and families across Surrey, and we have seen a significant increase in the requests for help and the requests for support for children. It's the number of children with eating disorders. We've seen a significant increase number of children attending A&E, self-harming, and in crisis, and really complex mental health needs.
We're quite a unique provider collaborative, and the uniqueness comes from the fact that we are not in partnership with a neighbouring mental health trust. We are in fact reporting to our ICS at Surrey Heartlands. So we are, I think, one of the few provider collaboratives nationally that are working in this way. So we work really closely with other provider collaboratives, particularly in the South East. However, the exciting thing is that we are aiming to have our own Surrey Tier 4 General Adolescent Unit by summer of 2023. It will change the dynamic for our provider collaborative because at the moment we don't have any Tier 4 beds in Surrey. But also as we're continuing to grow and develop and working with other provider collaboratives and neighbouring boroughs, there are other things that we can be learning from them. So it's really about keeping those relationships going and building that on.
We're part of a group of providers. We have access to healthcare as well as education and children's services, so a real multidisciplinary approach. We help to unblock barriers in the system to discharge, to accessing care, ensuring the care is within the most local area to the young person and their family.
And I think as well, when there are young people on our learning disability and autism programme, we make sure that the care they're being provided is really appropriate to them as well.
It's about relationship building, ensuring that we've got really good, healthy, collaborative working relationships with our providers, with our clinicians as well. So very often the role is a gateway between all those services. And it's about improving the quality of care, ensuring that all the children and young people and their families are accessing the highest standard of care.
We work really well and really closely with the community providers, so Surrey and Borders. We have Hope Services in place, which is a joint service that supports children that are in distress or in severe mental health issues, and we work really closely with the local authorities. So having a provider collaborative in Surrey means that we are already working in a really integrated way, and this just means it's just the last bit of jigsaw, really, if you like, for us in Surrey to be able to oversee the whole pathway for the child.
I work in the Child and Adolescent Eating Disorders team in Surrey, the community outpatient team, and I assess and provide medical treatment for young people with eating disorders. Our team is very dedicated to keeping our patients at home, and the Provider Collaborative has provided an opportunity to help reduce both the number of admissions and the duration of admission, so we can keep young people at home for as long as possible and treat them at home for as long as possible. We believe that young people get better at home with their families and with access to school and education rather than going to inpatient units where they're away from their families for months at a time and away from their friends and their schools.
One of the issues that there's been with care in the past is that it hasn't been fully joined up between the different providers that provide care. So what host provider collaboratives will do is allow for it all to be more joined up and for providers to collaborate more with each other, it's kind of in the name. And hopefully in terms of the real life impact on young people, that should mean that there's smoother pathways of care, that it will allow communication between different providers to occur more efficiently, and this will mean that you'd spend less time waiting between different referrals, different kind of parts of care. It will just really make things a lot more smooth, and also it introduces my role, which allows for more participation and co-production from young people and from their families. I think that the future for the provider collaboratives is very important in terms of the fact that we are able to arrange all of the pathways for that child. All of the decision and all the local delegated authority remains in Surrey, so we can make local decisions for local families, for children across Surrey.